Welcome to Season 3 of Chip Chat Conversations. This season, our focus is on COVID. One thing we all know is COVID invaded our lives and became up close and personal. This virus impacted everyone across the globe, regardless of your socioeconomic status, religion, career, job field, race, gender, etc., etc. This pandemic required that we adjust our lives to a new norm. I'll be sitting down and talking with parents, students, educators, those in the medical field, and others as we unpack this ever-evolving virus. Sit back, enjoy as we kick off Season 3 of Chip Chat Conversations. Well, hello, Pam.
Hey, Pastor.
It's so good to see you. Glad to have you part of Chip Chat Conversations.
Thank you.
As you can tell, we're doing some conversations really to look at how COVID has impacted people in various areas of life. But before we get into our conversation, I know you well, but maybe the people that are watching may not know you as well. My kids love you, and my wife and my kids love you and Joe. Y'all been so kind to us. But tell a little bit about your family.
I'm married to Joe Mizerany for 38 years. And I have a daughter who's at Florida State. She's 21. Her name's Kaylee Ann. And I've got a daughter, Katie. She's 37, and she's married to Josh Finkley. They have 4 kids. One was just born 2 weeks ago.
Ooh. Mm-hmm. And all their kids are adorable.
Well,
I just got to tell you,
so
adorable. Well, tell us a little bit about, one of the reasons why we have you here is knowing what you do professionally, and we have some other conversations with people who are in some other spheres of life. What do you do in your professional background?
I'm an RN, and I have my bachelor's degree from the University of Oklahoma since 1987. Joe and I both graduated together. He has a geology degree, not an RN. And I've been at Tampa General since 1989. I left twice, but came back. And so I've been pretty grounded there for a while, and have experienced the COVID through Tampa General eyes and the way they've handled things.
I got to tell you, of course, when I came here 5 years ago on staff at Idlewild, my first hospital visit at Tampa General Hospital, I was just completely lost. I was like, how am I going to navigate? This place is huge. I also saw some very nice houses on my way there too. That was great. But that's good. Well, tell us a little bit about how you've seen the impact of COVID up close and personal with your job.
Well, of course, we saw it coming down the pike, starting in New York in the papers, and I like to read the papers. And so when it started hitting Tampa General, they shut down the surgeries, at least the elective surgeries. So the population went down in preparation for a big surge of COVID patients. A lot of nurses, ironically, were not working, which you would think in an epidemic, a lot of nurses would be working. But I kept saying everything's so upside down because since there weren't nurses, in the recovery rooms, in the OR rooms, as many patients going out to the floor, the need for nurses went really down. So I found myself, losing all my vacation time, all my sick time. Oh, wow. But once that happened, Tampa General, they were trying to give us work and handing out masks, which was new also. That was interesting to see everybody in the whole hospital masked, which needed to be, and everybody, getting temperatures before they walked in. I also got to work several weeks in the COVID swab center for all the employees, and then their families too, if they were seeming, like they were symptomatic. And that was interesting. And that's where you really saw it was hitting everybody, because I saw, very prestigious doctors that had worked there for a long time, people I'd known in environmental services for decades. Wow. And everybody in the whole hospital was affected. There was one department they thought they were going to have to shut down because one person had infected so many people in that department. So it was interesting time. Still is interesting.
Yeah, I'm
and
sure.
Tampa General is very upfront. I can log in at any time and see the number of COVID patients that are in the hospital. Wow. They've built a place just for the COVID patients too. It's a rehab center that is on the island, but it's away from the hospital. You have to do a catwalk. So just to keep all the COVID patients away from all the other patients. They've done it, I think, in my opinion, an excellent job. I mean, this thing is evolving, you know, and so we're learning more and more. So things we did yesterday, we're not doing today, but we're growing and learning.
Yeah, I'm sure the chapter of the book you had in med school, no chapters cover this, but I'm sure there are new editions being written now, because it's just incredible. Same thing even in life of ministry as a pastor. I mean, there's nothing in seminary, nothing in training that prepared you for this, but you're just doing things. Has there been any situations that have been so unique for you to handle? I know you mentioned just when we were talking, even before we started taping, about a mother and a daughter.
Yes. We have a newsletter that comes out every week, and the nurse manager of the COVID unit, she was telling a story in the ICU. There was actually a mother and a daughter, an adult daughter and a mother. And the mother was dying, and they asked the adult daughter if they wanted the mother to be rolled into her ICU room so she could hold her hand while she died. And I'm just really proud that Tampa General made that happen, because as a nurse, I know how heavy those ICU beds are. I know if they were on ventilators, how many people it takes to move a ventilator with a patient in the bed, and all the drips and IV. I mean, that was a huge undertaking that they did totally out of compassion, because, you know, as you know, and have probably read in the headlines, people die by themselves with COVID. And it's just really sad. Yeah.
Well, I'll tell you, one of the things that is, you know, even when you mention, you know, things you read in the newspaper, on the media, you know, for you to be that up close and personal, this is why I'm having these conversations. I mean, that's something that you don't hear on CNN, Fox, or MSNBC. But one of the challenges we've had in this COVID era has been misconceptions and perceptions out there. So when it comes to, in your own experience, when it comes to masks and vaccinations, what have you seen, and what maybe some professional advice that you can help move away from some of the misconceptions and perceptions people may have?
Well, I would really encourage people to trust the experts and not, you know, the rock stars or the politicians, you know, the scientists.
And not Chip Luter.
The scientists that are following this, you know, and things are changing. And I think that frustrates people. They'll say, well, they said this a year ago, but now they're saying this now. And that's how science moves, though. Science isn't stagnant. It moves, and we learn more, so things do change. But I think that's part of the frustration. Sadly enough, I had a clergy person who I very much respect was very frustrated about 6 months ago about the Mass. And he said, have you ever heard of someone having a virus but having no symptoms? He said, have you ever heard of such a thing? You know, and he was frustrated. And I didn't say anything because I was kind of flabbergasted, but you know, there has been so much in our history. Typhoid Mary in 1900s. Wow. She infected hundreds of people in New York. She was a cook. No symptoms, never had a symptom. Wow. And several people died from her giving typhoid. I mean, AIDS, people can have AIDS, well, not AIDS, but HIV, and, you know, not show any symptoms until they have the whole AIDS syndrome, you know, and TB can be the same way. So people just need to really be educated, you know, and to look at the science, you know, and what is the latest science? And I think it's very sad that people are looking to Facebook for their information, you know, and, you know, I wear, right now you and I are distancing, but, you know, we wear masks for each other, you know, and what a loving thing to do, and a Christian thing to do for other people, to wear masks for each other, especially now that Florida is the #1 state with this UK mutation strain, which is much more susceptible to be passed. It is not more deadly, thankfully, but it is much more easily spread, and Florida's #1. So as Christians, why wouldn't we wear masks for each other? You know, and that's one of the things I've really had to pray about. I am not God. I am trying not to play God to anybody else. And It's been discouraging, though. It's been a little discouraging.
Have you seen a similar thing with vaccinations, how people come at with vaccinations?
Yeah, but
you've gotten yours?
Yes, I've got both my vaccinations, thankfully. Tampa General made sure everyone that wanted one, got it, and I was one of the first. And so I would definitely encourage, people to get their vaccinations. But they say you still need to wear your mask. Sure. Vaccinations, I think, are 95% at best of what they're hoping for. And, there's another mutation strain coming out of South Africa that they're not sure the vaccination is going to cover. But they think if you do get this new strain, it will not be as severe.
Sure.
So there's a lot going on, and there's a lot to stay educated about.
Well, I tell you, one of the things that is most challenging, and I think it's just the human condition, I think we always want to feel like we have more knowledge and more wisdom than we really do. One of my favorite passages, I can't remember the exact number in Proverbs, but I remember in Proverbs, the writer at one point says, I know nothing, I'm the most ignorant, and he just owns his limitation of knowledge. And I love to tell people and I say it to myself, there's only one person who's omniscient, and that's all-knowing. There's only one all-knowing person, and there's only one all-present person, and no human is it. And so, but that's my faith. And I also want to ask you about that. Where have you seen your faith help you navigate and walk through these times as a healthcare professional? You're not just any healthcare professional. You're a woman of God, a follower of Jesus Christ, who is a healthcare professional. So where's that faith intersected with what you do?
Well, Pastor, you just did it for me. You just, what you said, I need to take it down and be humble. I get very frustrated, as you probably already heard, of people just not wearing masks and just feeling like it doesn't pertain to them. But what you just said, I don't know everything, and the science does keep changing, like I've already said. So I appreciate you bringing that out, because humility is very important, and love is what it's all about, and so I appreciate what you said.
Well, what about you and how you interact with patients these days, knowing that you're a woman of faith and people are battling this tough virus, and you got people who are dealing with, not only, some people have been able to have it, struggle through it, but then live. What about those patients that you had to watch who've actually struggled with it and passed on? How's your faith helped you in navigating and watching that?
Oh, wow. Well, I keep thinking of the verse, consider it all joy when we face various trials, right? So Christians, this can really, I think, I feel more not as close in my church as I used to enjoy. The Thursday nights are gone. I love seeing the people on Sundays, but I know you have been so careful about watching the numbers and wanting to keep us all safe, and I appreciate that. I guess it's most affected me personally. Sure. Is just the frustration I feel of fellow Christians that I feel like aren't taking it seriously. I just will never forget when I did a contract on the COVID floor at Tampa General, and I was taking care of all types of people, young people too, a pharmacist who was having symptoms a month later of respiratory distress and couldn't breathe, a school counselor from our public school system who, was so scared. And that's the one thing, these COVID patients are very, very frightened, as you can imagine. Sure. And then having to help transport a patient from that COVID med-surg floor to the ICU, and I saw the ICU, how incredibly busy it was. And in each room, there were just probably 3-4 different people in the room, staff people trying to help each person survive. They were on ventilators, they were prone, because that's one of the treatments, is to turn a patient on their stomach to help aerate the lungs. So these patients are prone, they're on ventilators. The IV pumps are outside the room with the cords running under so they can make the changes on the pump. I'd never seen an ICU like that ever. And I've worked a lot of ICUs, adult ICUs through my career. And if I could just take people in those ICUs, but of course we can't because of HIPAA. But
sure. And there's got to be a difference, I'm sure, between watching people who have a walking faith with the Lord and how they navigate these times? And have you seen a difference of any people you can tell, oh man, they must be a person of faith, or people who aren't a person of faith and how they respond to these traumatic times?
Yeah, I think, just definitely like what you just brought out about humility, which I really need to, I ask God a lot for humility. And just the humbleness and the calmness. When I see, professionals at work that are so calm, especially when I was working those COVID units, just the calmness and not getting hysterical. And and they will take precautions. Even if a patient suddenly starts coding, it has been made very clear we have to put on all our protection before we can walk into that room, and how they are protecting themselves, but not with fear. These professionals aren't fearful. They're taking care of the patient, but they're not fearful. They're taking all the precautions. And, of course, now that the vaccines are out, that's helpful too, to make you feel more secure.
Well, this would be my last thing. One thing I love to do in these conversations, even when we had the ones on race and justice and reconciliation, is so the world can be, this is something that can stress everybody out. It is stressing a lot of people out. But as believers, one thing we know is this world is not our home. So we have another land to go to. There'll be no masks in heaven and no COVID. I'm so excited. But I think in moments that can be as stressful as this, there should be some things that should encourage us as believers, or maybe even opportunities God is giving us in the times that are most stressful, most traumatic, as maybe gospel opportunities. What would be something you would say from your own personal perspective of certain things that should encourage us as believers?
Yes.
And even some opportunities we should be taking advantage of, and not just falling away with all the stress and trauma with the world and media and all that.
Yeah, I would say, be smart, take the precautions, not just for yourself, but for your loved ones and those around you. And also, for me, and I think for most other people, to get out of my own head. When I have fear, to go help someone else, with your mask on. But to get out, to get out of your own head, because fear is not from God. We know that, right?
Amen.
So, yeah, I would definitely say get out of our own heads and help somebody. In the name of Christ.
Well, Pam, thank you so much for being here. Hope you've enjoyed it. Please give Joe a good report on how this went well. I want Joe to keep tithing at the church. But I've definitely appreciated this, and appreciate you and your love for me and my family all these years.
I do love you.
Thank you guys for joining us. We look forward to next time.